All right, friends, another week, another episode. This episode actually goes out dedicated to a very special patient who posed this question, and you guys have questions, I have answers. So today's topic, we're going to be talking about gestational surrogacy. And I want to start by first saying, Hollywood, I will give them credit. They've done a great job of bringing IVF and assisted reproduction to the forefront. They've made it dinner conversation, which is great. But sometimes along with that, we come along some misinformation. And so it's really important that when you are navigating these decisions, that you have a really good relationship with your fertility specialist and that you talk to them about these different treatment options. So we'll start by saying that gestational surrogacy falls under this umbrella term that we call third-party reproduction. And third-party reproduction is any technique or technology that we are using that doesn't involve specifically the patient and a partner. And so, for example, if the couple requires an egg donor, a sperm donor, a donated embryo, or a gestational surrogate, they would all fall under that umbrella of third-party reproduction. And generally speaking, not always, but generally speaking, these technologies are associated, or treatment options, I should say, are associated with the use of IVF or in vitro fertilization. So a gestational surrogate is somebody that is carrying a pregnancy for somebody else. So the egg is not her egg, and the sperm obviously not her sperm, right? So the embryo is somebody else's, and this is a patient that has to have had her own child before. And that is a very clear black and white guideline from the American Society of Reproductive Medicine. Now, when you start to look at who would be a good candidate for gestational surrogacy, there's two candidates that we're talking about. One is the patient that might be exploring the use of a gestational surrogate. And then on the other side, we talk about the gestational surrogate themselves. So who would make a good candidate to actually be a surrogate or go through surrogacy? So let's start with the surrogate first. It's really important to understand that most of them, not all of them, but most of them are working with a gestational surrogacy agency. And that agency is really the one that helps to coordinate the matches between the intended parent or intended parents and the gestational surrogate. However, a lot of these agencies, well, I should say this industry in general is not regulated, right? And so then it's really left to your fertility clinic and your fertility doctor to determine whether the gestational surrogate is a good candidate or not. So things that your doctor might be looking at is how old is the patient? How many pregnancies or deliveries has she had in the past? How healthy is she? So what is her weight? What is her nutrition? Does she have any medical problems, any surgeries? Does she take any medications, etc.? Has she done the process before, and what were the outcomes of that process? So there's several different factors that they're looking at. And really having that open communication between your doctor and yourself to think about, okay, are any of these things a deal breaker for me, or am I comfortable moving forward with this patient? Because you have to remember, it's not just about the IVF process and getting them pregnant. You are now going to be tied to this person for the subsequent 9 months of pregnancy. So it's really important that the gestational surrogate be somebody that you know, like, and trust, and that has really gone through a rigorous screening to make sure that we're not putting the surrogate at risk and we're not putting the embryos at risk, okay? So it's really looking out for everybody's safety. Generally speaking, there is pretty thorough screening that goes into it. They have to, have a screening process or questionnaire looking at their history. They typically have to have a psychological evaluation. If they have a partner, then typically the partner will also have to undergo these same questions and that same psychological evaluation. And then once they're matched, there's a legal contract that binds, basically relinquishing any paternity rights of that mother to that embryo that's growing inside of her. So those are all the kind of the initial first steps. And then there may be some additional testing that your doctor wants to do to check her uterus, make sure that everything is good, that it's apt to proceed forward, and then they would plan for the treatment process to put the embryos back in. So for many patients, they want to explore the surrogacy process first, but really for many, what we look at is first making sure we have embryos to work with and then embarking on this journey. The gestational surrogacy journey is a very, very costly journey. It can take a lot of time until you find somebody that you're comfortable with and feel matched with. And number 3 is we talked about cost, and it's a very emotional journey, right? So this is somebody that's going to be carrying your embryo, your baby. This is someone that's going to be nurturing that pregnancy for those 9 months until delivery. So all of those things, it's a huge investment. It's not just a flip the switch and let's just do this. And for the intended parents or parent, there will also be a psychological evaluation just to make sure that everybody's on board with the process and they've really had time to think through the process of surrogacy. So who would be considered a candidate to explore gestational surrogacy? There's a number of them, okay? But when you talk about indications for gestational surrogacy, we typically talk about uterine factor infertility. So uterine factor infertility is when there is an issue with the uterus that is in some way impairing implantation. So for example, if the patient had major surgery on her uterus and now there's scar tissue, if she has fibroids that just keep coming back and the uterus is just not apt to receive that embryo, anything that could relate to that uterus. Maybe the patient was born without a uterus, something known as Mullerian agenesis or Meyer-Rokitansky. That would be a patient that would require gestational surrogacy. And while uterine factor infertility is the most common, it's not the only indication. So for example, let's say a patient has some severe medical illness and pregnancy would not be safe for her, then that is somebody who would consider gestational surrogacy. Or let's say somebody has had some sort of organ transplant and they're on medications that are not safe for pregnancy, but they cannot come off of them. So that may be somebody that considers gestational surrogacy. Also, there could be non-medical indications for gestational surrogacy. So for example, if it's a same-sex male-male couple, then they would need a uterus and they would need a gestational surrogate to build their family. Other indications. So one thing that's important about indications is that there is not a federal law regulating the use of gestational surrogacy. This is left to the states to decide. So depending on the state that you're in, there may be more or less regulations in terms of who can use a gestational surrogate. So it's really important that when you're talking to your fertility specialist, that you have a clear idea on whether or not you would be a candidate for that treatment process. And one last concept that I'll leave you with. My older patients many times inquire about the use of gestational surrogacy as a way to overcome that ovarian aging process. But remember that the use of a surrogate is really to carry a pregnancy. It's not really to generate embryos. So the aging process is affecting the ovaries and the eggs. It's really not impacting the uterus, at least not in a meaningful way. So when we talk about the ovarian aging process and third-party reproduction, that is typically where we'll begin to talk about using somebody else's egg, so a donor egg, or using a donor embryo. Now, final concept, and then I promise I'll let you go. When we talk about gestational surrogates who are coming through an agency, the guidelines are going to be extremely, the recommendations from your doctor, they're going to be extremely strict because we want to make sure that this is an ideal situation for the patient and an ideal situation for the surrogate. But let's say you don't go through an agency. Let's say it's someone you know, a family member, a friend, somebody that's in your world that you're bringing to the clinic. That is going to be a little bit more of an open discussion because we still want to be safe and we still want to make sure everyone meets requirements and that there's not, increased risk to mom or, the surrogate or the embryos. But we do want to also take into consideration that this is somebody that's known to you and there's a trust factor there, and you're not going through an agency. So for some patients, the guidelines may be a little more or a little less strict, I should say. So I hope this information was helpful. Gestational surrogacy is definitely a complex topic, not one that can be covered in a 10-minute YouTube video, but I thought it was important to just highlight some of the big concepts that you may come across as you're beginning to explore this treatment option. And to my patient out there, I hope this has been useful to you. I really wanted to make sure you got this information and that I was able to share it with our entire audience as well. So you all have a great day. If you want to work with me, remember, in California, I am working through Women's Specialty and Fertility Center, and you can book a tele-video consult through them. If you are a Florida patient, be sure to go to my website, drcarolinaswaldo.com, and send me a message. We'll get you scheduled right away. Talk to you soon, guys. Bye-bye now.